Name's Walter Egenmaier. I'm an optometrist and I work in a medical surgical group that's an optometric referral center in Evansville, Indiana. We used a Macintosh system for many years. I got deployed for the Second Gulf War down to Fort Bragg, and my partners called me about 6 months later and said the whole system had crashed and they needed to look into other software. So I went to the next meeting that I could and I researched it, and I've been researching for about 2 to 4 years, but I'd pretty much narrowed it down to 2 or 3, and when I came to MD Office it was a no-brainer. Well, first of all, the company had been around for a long time. The CEO at the time had a product that he'd started back in '85 and had refined, so by the time we saw it, it had already been in use for about 15 years, and it was a practice management system that was just flawless. It was easy to use, easy to train, had all the boxes, bells, whistles that you needed, not more than you needed. It was very expertly done. Their support staff was phenomenal. At that time, they did not have EMR. What they did is they decided that they were going to go ahead and add EMR to the practice management software, and they collected about 15 doctors across the United States who have been using electronic medical records in the past. Things that they wanted, things that they didn't want. They did an entirely new approach that was fantastic. Rather than just create something that was made by programmers, they got the input of the doctor up front saying, I don't care if it does this, I want it to do this. And this is the most doctor-oriented software engineered program I've ever seen. Most people give you a tool and then you have to adjust to how to use it. In this case, this was doctor recommended, this is what we need, and it just, I think, comes out with a better product. I work in a medical surgical practice, so I do see a lot of glaucoma, disease, injuries, so it's more a medical side of the optometry. We don't do glasses or contacts. I don't use their optical side, so I'm not familiar with that portion of it. But as far as the medical side, this can be used by any optometrist. In fact, my daughter is an optometrist. She's two blocks down the road from me, and they have MD Office because they've gone through 4 programs and were not happy with any of them. And they came up to this one. I said, look, yes, it's medical, it's called MD Office, but it is very optometric friendly.